Bone health, as I'm hoping that you're realizing, is multifactorial. There are many things that contribute to it: genetics, nutrition, hormones, lifestyle. So, most of our bone's mass, about 70%, is determined before birth, but the rest is up to us. Women whose mothers have suffered several adult fractures may have lower bone mass. Exercise provides mechanical stress that stimulates the growth of bone. When strain and effort exceed a certain level, they influence the strength and architecture of the bones they load. So, the type and intensity of exercise affects how bones strengthen or form. That's why athletes have stronger bones than lower force exercisers. An active lifestyle also helps us to maintain our bone mass. Bone density testing is actually very easy and relatively quick. You can use a Dexa Scan, and this measures bone density and is fairly accurate. It's something that you can talk to your physician about. Low bone density is one of the risk factors for fracture. So when combined with age, fracture history, low body weight, medications, height loss, poor vision, and medical conditions, bone density is used to predict the likelihood of fractures. Currently, treatment of osteoporosis is focused on bone density scores. In the future, multiple fracture risk factors will be direct input for the treatment decisions. The World Health Organization soon will revise its recommendations for osteoporosis treatment based on a fracture risk prediction model. The National Osteoporosis Foundation will also revise its guidelines. Currently, the gold standard, or the absolute test for determining the amount of bone density an individual has, is a Dexa scan. It is like an X-ray with minimal radiation. The exposure is no greater than a plane trip from San Francisco to Boston. A Dexa scan is used to determine bone density. This scan can help you decide whether you need to modify your lifestyle or change your dietary and exercise habits. The results may help your doctor decide whether to prescribe medication or other treatments to reduce your risk of fracture. For the full Dexa scan, you lie on a table with your clothes on as the scanner passes over you, measuring the bone mass in your hip and lumbar spine. A computer determines how much bone you have by the information read by the scanner. The Dexa scan will give you what they call a T-score. This is the amount of bone you have compared to healthy, normal people at the age of 30. A T-score is a statistical number that indicates whether you are above or below normal. Normal T-scores range from a +1 to a -1. Low bone mass, or osteopenia, is indicated by a T-score of -1 to -2.5. Osteoporosis is indicated by a T-score of less than -5. The Dexa scan and these numbers are all things to speak with your physician about. Why do healthy bones matter? I think that it's important to remember that the bones help you do a lot of things. The bones give support and allow you to move. They're strong, dense, full of minerals. They protect our brain, lungs, and internal organs and resist against fractures. I think the biggest part about that, though, is healthy bones allow us to move and allow us to be independent and functional and allow us to do the things we want to do during the day. This is a neat image that shows us when our bones are growing or diminishing and how fast that process is happening. Our skeleton begins to develop before we are born and continues to grow through early adulthood. Bone mass is maximized with healthy eating, physical exercise, especially weight-bearing exercises, and appropriate body weight. It's our bone bank for life. Bone mass decreases with age, changes can occur over decades. In childhood, new bone formation exceeds depletion. Later, this process is reversed. By the age of 29, bone mass has reached its peak of strength and density, In our 30s, we start to lose bone mass at a rate of about 0.3 to 1% a year. After female menopause, bone loss accelerates 1 to 5% a year. By age 65, loss is universal but slower. What are the benefits of exercise for your bone health? Studies have shown that physically active individuals of all ages have more bone mass than those who are less active. According to Beck and Snow, the actual difference depends on three things: the type and intensity of the exercise, the age at which it began, and the number of years of training. Overall, evidence from both human and animal studies supports regular physical activity, especially if started in early childhood and adolescence, to improve bone strength and reduce the risk of falls and fractures. Exercise also is known to enhance the benefits of other bone building and fracture reducing interventions. The earlier the better. Exercise and an active lifestyle are best if started when the skeleton is still developing before the age of 30. Exercise should be lifelong, it should be long-term, or you lose the benefits gained. Stay on track, but feel free to introduce changes and vary the mix. Any exercise is good, and most importantly, I think for this slide, is that it's never too late. You can make positive gains at any time and at any age. Fight fractures with fitness. Research has demonstrated that exercise reduces fracture risk in many ways. Exercise increases peak bone mass. Increased activity during childhood contributes to achieving a higher peak bone mass in your bone bank for life. Bone mineral density is a key predictor of fracture risk, and higher bone mineral density means you have a lower risk. Active lifestyles are associated with higher bone density. Exercises also reduce subsequent loss of bone mass. There is a relationship between the strength of the muscle and the strength of the underlying bone. Developing strong muscles is key to developing and maintaining strong bones for life. Spinal extensor strengthening exercises decrease thoracic kyphosis in women with increased kyphosis, which also decreases fractures long term. Recent data demonstrates that increased kyphosis is a risk factor for future fractures independent of previous fractures or low bone mass. Strength, balance, and coordination exercises improve balance and reduce the risk of falls. Decreasing falls reduces associated fractures. So exercise builds bone. Exercise provides a mechanical stress that stimulates bone growth. When strain and effort exceed a certain level, they influence the strength and architecture of the bones they load. Bone cells called osteocytes monitor the strain in the bone around them. If the strain is high, they signal the formation of bone. If the strain is low, they signal a decrease in bone formation and an increase in bone reabsorption. Research has shown that bed rest, paralysis, unweighting, and other forms of muscle disuse cause increased bone resorption for 6 to 12 months at as much as 1 to 2% loss per month. Mechanical loading, on the other hand, is associated with increased bone mass. Tennis players are one example. Their dominant arm is bigger and has more bone mass. Frost in 2001 stated that both the type and intensity of the exercise matters. To be osteogenic or bone building, the activity must exceed normal or usual loads. The load must be increased progressively. Kelly and Kerr in 1996 and 1998 stated that bones can be strengthened where muscles pull on their attachments. If you want to strengthen hip bones, you must strengthen the muscles that attach to the hip, or else the load the bone through the weight-bearing exercises and compressive forces. Gains in bone mineral density are possible at any age, but less with advancing age and especially after menopause. Recent meta-analysis demonstrated that across all groups of women, resistance training seems to preserve or slightly increase bone mineral density in the lumbar spine and in the hip and wrist in post-menopausal women. In other words, you can gain bone at any time. Aerobic exercise does not appear to improve bone density in postmenopausal women, as indicated in an analysis of controlled clinical trials with individual patient data by Kelly in 2001 and 2006. These are a couple guidelines for bone strengthening exercises. Each of these are things that you can confirm or confer with your physical therapist and physician about. In general, though, children and adolescents should perform high-impact, high-intensity exercise for 10 to 20 minutes 2 or more times a day, and at least 3 days a week. Healthy adults should be able to perform moderate to high-intensity exercise, weight-bearing activity 3 to 5 times per week, including some jumping, and resistance exercises at least 2 to 3 times per week, at least one set of 10 repetitions and up to 3 sets. 30 to 60 minutes a day of a combination of the above recommendations. What should children and teens do? Lots and lots and lots of activity. Jump and play hard. Do high-impact, weight-bearing exercises, and add as much variety as possible. Studies have shown that vigorous exercise during growth can increase peak bone mass by 10 to 20%. Playing hard in pre-puberty has a lifelong positive effect on bone mineral density. In the study by Bass, retired gymnasts developed and maintained a higher bone mineral density than their peers. Jumping in the form of jumping jacks, rope jumping, and jumping off a platform appear to be particularly efficient ways to improve peak bone mass in young girls. High-impact activity early in life also may have protective effect in later years. Studies of young female athletes later in life found greater bone mass after menopause, suggesting less decline in bone mass content than the non-athletic population. Even moderate exercise during growth years increases bone mineral density, as shown in a study by Bradney in 1998. Young healthy adults should be very active as well, including resistance training, high-impact weight-bearing exercises, and core stability and postural strengthening. After puberty, bone mineral density does not increase as readily, but still does. The main role of exercise in young adults is to maintain bone mineral density and maybe even increase it a little. Nevertheless, high-intensity exercise can lead to modest bone increase in targeted areas. Even small increases in bone mineral density may significantly reduce the risk of fractures later in life. Resistance training produces large site-specific gains in muscle strength and small but appreciable gains in the underlying bone. The general health recommendations for someone over the age of 50 is moderate intensity exercise of varying types, core stability, and balance and coordination activities. The main goals for bone health in healthy adults over the age of 50 is to maintain bone mineral density and prevent fractures by improving muscle function. Strong muscles, good balance, and erect posture decrease the risk for falls and fractures. A prospective study showed that 60% reduction in hip fracture rates in men who were physically very active compared to those who were not.